As a case manager, the first thing that we do is to get in touch with the family when we get their request, to try to understand their needs and why they have contacted Sant Joan de Déu. My name is Maisa, and I'm working as case manager at the international department. We are basically there to assist them and help them to arrive to Sant Joan de Déu.
Since I started in the international department, I have been doing like patient manager all the time. The difference between case manager and the patient manager is case manager is in charge of the patient before their arrival, and the patient manager, we take care of them since they arrive at hospital and until they leave.
We prepare a personalized proposal and we schedule their appointments here. We assist them if they need accommodation or anything that they could need during their stay here in Barcelona.
What we do every day during the treatment of our patient is we schedule all their visits and tests during their stay in the hospital, and we order and provide services of translation and transfer.
Actually, we receive a lot of a second opinion with that. The families, they do not need to come personally here to Barcelona, but they need a medical opinion of our medical team. And even if it's necessary in the place or in the country where the family lives.
As a patient manager, we are in contact with doctors, with nurses, and with patients. For me, it's very important to have contact with different kind of sector, different kind of teams, and for me it's very interesting to making the connection between different teams and between doctors and families.
This is a continuous struggle because, the difference between cultures, it's not easy for each family. It depends from which zone we're talking. If we're talking about European or from the Middle East or from Latin America or from Asia, we have different cultures here.
Working in the sanitary sector for me is helping patients and helping families from all around the world.
I always try to do my best in my job because I always think about these families that they have children, and if they have contacted our hospital is because they need our help.